dear viewers, we are back to Hello Kuwait and we have been joined by our second and final guest for this evening. We have with us Dr. Ramnarayan Ramachandran, consultant restorative and functional neurosurgeon. Good evening, doctor. Welcome to Hello Kuwait.
Thank you very much.
It's a pleasure, of course, to have you back with us. And today we're going to be talking about two topics.
Sure.
So let's start out with what is failed back surgery syndrome?
Okay. See, obviously the name itself explains that is failed back surgery syndrome. Okay. So what happens is, back surgery is probably the most common neuro-related surgery in the whole world.
Right.
More people have back surgeries than any other surgeries for neuro problems.
Yes.
And everywhere, any part of this. Because all of us get back pain, you get operated. But what happens is, in some people, either the pain does not go away or after a few months the pain comes back.
Right.
And I'm sure everybody of us knows somebody who has undergone surgery but no benefit.
Yes.
And this is called failed back surgery syndrome.
Right.
Okay. There are many reasons for this. Many reasons for this happening. Of course, it's nothing to do with the hospital or the surgeon or anything.
Okay.
Anywhere it fails. And our textbooks say that the incidence is 30 to 40%. So if 100 people get operated, 30 people can get failed back syndrome.
Yeah, so it's very common to get.
Quite common. It's quite common. And there are many reasons for this. Because one is, of course, the anatomy, the structure of the bones may not be the same in all patients. Sometimes there may be some extra bone, sometimes there will be less number of bones.
Yes.
And sometimes, there will be other associated problems, like canal stenosis, there may be associated problems. So if you remove somebody has a disc and then there is a associated what we call canal stenosis.
Right.
If you remove the disc alone, it is not helpful because this will create trouble.
Okay.
So like that, there are various causes where it causes failure. And other reason is, I'm sure sometimes we see some people who are bedridden for many years and they develop bed sores, and you always see develop bed sores here only.
Yes.
Nobody develop bed sore here or hand.
Definitely.
Because by birth itself, that area, this back, we call it the small of the back, that area has got a lot of negatives. For example, the blood supply to that area, even in normal people, is very less.
Definitely.
Okay, and then it is a pressure point. So many reasons like it. So already that area is not a good area for surgery, and then you do a surgery, and then there is associated problem. So invariably the surgery fails.
Makes sense. So if the surgery does fail and it's an actual syndrome, what are the other treatment options? What can the patient do
actually,
in this case?
In failed back syndrome, in fact, I have recently described what is called the extended failed back syndrome. So what happens is not only pain. Unfortunately, a lot of people get involvement of the urine bowel gets affected.
Yes.
And some people get what you call foot drop. Their foot goes like this. For walking, see, when we walk, we are actually walking like aircraft landing. I'm sure we have all seen. The aircraft doesn't land like this. It lands like this, and then the front wheel touches the ground.
That's right.
Same like that, when we are walking, we land on the back of the leg, and then the front of the foot rather falls. Okay. But if the foot is like this, how can you walk? You will tend to fall down, trip and fall down, injure your face, injure your nose and all that. The other problem which happens is in some people is, they lose sensation.
Right.
They lose their sensation and all that. So this is a major problem. You go for one problem but end up having another problem.
Definitely.
Okay, so pain also is there. Some people lose their urine bowel control. Some people have get difficulty in walking. These are all the various problems.
Definitely.
Okay. So what you do is, obviously you have to treat this because it is affecting the quality of life of the person. So you first find out why the surgery failed. There are various ways. We can repeat MRIs. We call dynamic MRIs, dynamic X-rays. We can find out whether what is the reason why the surgery failed.
Yes.
And suppose we find that suppose sometimes we think we have removed a disc completely, but there may be still some disc remaining which did not come in our instruments. Okay, so you go in, do a major surgery, and remove that. Complete the removal.
Go for another surgery, basically.
Yes, go for another surgery. Go for the thing. But sometimes you will find that there is nothing. You cannot make out any cause. Then you try simple techniques like asking the patient to take bed rest for 3 weeks.
Yes.
Giving him medicines, local applications, ointments and things like that. Lot of people do improve with this, and some of them may be also associated with some psychological problems. So what I do in my practice is somebody comes with failed back syndrome, I always send them for a counseling also.
Okay, so
And
like
then
a cooling period, counseling before you actually take the next step.
Exactly. No. Surgery, if you think there is something is left behind, you have to go for surgery. You have no option.
Right.
But if there is nothing remaining behind, if there's something which you cannot do anything, we send for all this counseling, medical medicines and all that.
Right.
Still, one big problem with back pain is if suppose you ask me to do something now, I don't want to do it. I will say, no dear, I am having severe headache. There is no way you can find out whether I am telling the truth or not.
Of course.
You have to believe me, because there's no. Suppose I say I have fever, you can come and touch and see whether I have fever. But if I am having headache, how will you find out?
Exactly.
So that is why back pain also, there's a very high litigation issues. A lot of people go to court saying that because of my work I got this back pain, so I want compensation, things like that.
So it causes a lot of issues, since you can't actually get proof.
Legal problems.
Of course.
So you also have to be careful of that. So that's why you always send to a psychologist and all that.
Definitely.
But there are still some patients, probably about 20-30% of patients, who still will not benefit from any of these things.
Right. And what do they do?
Yes. Sorry.
What can they do about it?
Yes. So that is where my specialization comes in. As I was telling you earlier, I do a lot of surgeries not done by anybody else. And one of the surgeries I do is what's called spinal cord stimulation.
Yes.
Or another surgery is called intrathecal morphine pump. Okay. So I'm not going to the technical details. But the pump is what we do is we put a pump here under the skin, and we deliver the drug morphine directly into the spinal cord.
Wow.
And morphine is 100% the best painkiller possible.
Right.
And advantage of putting it directly into the spinal cord is they won't get addicted, they won't get other complications of morphine. You can give it for 20 years also, patient will not have any addiction.
No issues with that.
Yes, no issues with that. And it is very effective. And you can adjust the dose, you can increase the dose, decrease the dose. The patient himself or herself can adjust the dose as per the requirement. Second thing, in some patients, they also get pain in the back as well as pain in the legs also.
That's right.
So that time what we do is what's called a spinal cord stimulation. We put a stimulator in the spinal cord, we put it somewhere here, and we put a battery here, and we stimulate. When we stimulate, they get very good pain relief. And this is basically, I follow the NICE guide. NICE means National Institute of Clinical Excellence. That's a UK based system, where the NICE guidelines say that whenever you get a failed back syndrome, you have to think of spinal cord stimulation as a treatment modality. So with these techniques, almost 100% of them do very well.
Okay, that's perfect. So there are different options if the patient actually has the back surgery syndrome.
Yes.
So you also mentioned another issue they might have is urine control issues.
Yes.
So what are the different types of loss of urine control?
Yes, actually, there are two situations. See, before that, let us, I will take you to a scenario which all of us face in our life. See, you are in a very, suppose your MD or your chairman has come. He has called all of you for a meeting. That time your urine bladder is full, but you cannot get out because the chairman is there. You cannot walk out. So what will you do? For some time we have this sensation, a very irritating, not very painful, but a irritating sensation.
Right.
I'm sure we all pass through this in life. But what happens is, the brain, after some time, the brain will tell the urinary bladder, no, you cannot go out, big man is talking, so you readjust. It will tell the urinary bladder. So the bladder will adjust. But I'm again not going into the technical details of how you do that. So after some time, the sensation will go away. For another 1 to 2 hours, you won't have the sensation again. I'm sure all of us face this. So this is controlled directly by the brain.
Right.
Because the brain will assess the situation. Okay, it's a big meeting going on. We cannot go out, or you are in a place where there is no restroom. You hold on, like that situation scenario. But in some situations, the brain loses the control of the bladder. Okay, this happens in a spinal cord injury. We have seen people wheelchair bound, the spinal cord gets cut.
Right.
This happens especially in a country like Kuwait or Saudi Arabia. Multiple sclerosis is a major issue, where the brain control over the lower structures are lost. Then you get so many other conditions. And this we call neurogenic bladder. That is, bladder control lost due to a nervous problem, whether the brain or the spinal cord or whatever it is. Okay, because there are multiple centers, not only brain, lower, multiple centers which control the urinary bladder. So when these are lost, we call it a neurogenic bladder.
So we can say these are the causes.
These are the various causes. That is basically the causes are from a nerve damage. Either injury or diseases like multiple sclerosis, Parkinson disease, so many conditions are there.
Of course, I can imagine.
Okay. And then these are of two types. One is what you call overactive bladder, where people are unable to control their urine. The urine goes continuously without control. That is, somebody wants to pass urine, the restroom is there. Even before they reach the restroom, they pass urine, the dress or whatever it is, a diaper or whatever it is. Second is what you call retention. Obviously, the name is very clear, retention. They want to pass urine, they have a sensation, but they go to the restroom, it doesn't come out. So both situations happen. Again, I am not going into where happens where. But usually with spinal cord injury, higher levels and all that, you get overactive bladder. Lower level injury, you get underactive bladder. With multiple sclerosis, you most of the time get overactive bladder, like that.
Definitely. So it differs from, of course, cause to another. And how can we treat those?
Yes, before that, I would like to tell you why this is important. One is, of course, social. So you cannot be dribbling urine 24 hours, 7 days a week. No, that's one thing. Second thing is, if you don't pass urine when you want, the urine gets accumulated. It causes severe infection.
Right.
Second thing is, it will go back to the kidney and cause severe kidney damage. So most of the people who are not treated end up having kidney failure. They, the dialysis, that's another hell. Dialysis, kidney transplant, that's a totally different hell. So obviously we have to treat these patients. So what we do is we actually assess these patients. Of course, there are two methods. Again, as I said earlier, for the failed back syndrome, they said surgical treatment, non-surgical. So initially we always try non-surgical treatment. There are some drugs like Uribax and all that. Some people with these medicines, they are able to achieve success. Especially people who are unable to pass urine, that is retention people, with tablets they improve. Then there are some injections, some Botox injections and all. Some people improve all that. So like that, there are some simple techniques which we use, which can help them, one-time shots or medicines. But a majority of the patients don't improve because the main control center is lost.
Of course. So it definitely depends on the patient, as you mentioned.
Exactly. So in those patients, what we do is what a surgery called sacral nerve stimulation. That is, sacral nerve is a set of nerves which come from the back and supply the bladder and the bowel.
Definitely.
Okay. And this is 5 nerves. We call it S1, 2, 3, 4, 5. Out of it, 2, 3 and 4 are the ones which control the bladder.
Yes.
2, 3 and 4 are the ones which control the bladder.
That's amazing. Well, Doctor, thank you so much for all the information you have given us for this evening. Thank you for